We are breaking ground for the first emergency hospital in the region and pretty much in Kenya. The needs for this is immense. A lot of people are losing their lives unnecessarily, and we got the inspiration to get this to start in the locality. There's no reason why we have to do it somewhere in Nairobi while other people are suffering or cannot afford to get that information. So my name is Dr. Nyakweba, and I'm a pharmacist by profession. And we got together and teamed up with my friend Dr. Moseti, who is an authority in emergency medicine, and I'll let him expand more and more that is about.
But then,
the inspiration for this project is I lost my brother at the age of 4 because he had pneumonia and breathing difficulties, and there was no oxygen in the local hospital. So I imagine there are a lot of people who are losing their lives for very essential things that are required in hospitals that keep people alive. So I've always been, I've had the thought and kept it at the back of my mind that if I had an opportunity to do something to change that and save lives in a community, if I had the opportunity to change and do something to save lives in my community, then I have to. So with talking and networking and getting to know many friends and being in the profession, I was able to get a lot of support. As you see today, all these people here share the vision, they understand the need, so we're here to support and get this project going.
lastly,
Initially raised $5 million, so I think that's in the range of $750 million to get the first phase going, and then we'll just keep going. The sky is the limit.
thank you.
Good afternoon, everyone. My name is Dr. Moseti. I'm an emergency and critical care physician in Perth, Western Australia, and in Sydney. I work part-time in Australia and part-time in Kenya, and I've previously been the head of department at the Nairobi Hospital. Emergency medicine is not well known in this country, because what happens when you're sick, you will say, I know a pediatrician, I know a surgeon, I know a cardiologist, but the day, as I said before, the day you try to die, the time you go to a hospital, everybody who's unwell, the first thing you go to hospital, for example, you're going to Nyamira hospital, you are not going to meet your cardiologist, right? You are not going to meet your surgeon. You will meet a healthcare provider, be it a nurse, be it a doctor, who will see you at the emergency department and stabilize you the first 1 hour. In Australia now we have gone to the first 4 hours. It's critical, and we are even extending it now in Australia. Even the first 24 hours you need an emergency physician. In countries, developed countries like Australia, the US, emergency medicine is a core specialty. I trained in emergency medicine for 7 years after my initial medical training. So emergency medicine reflects not only the health of the society, but community resilience, right? If we do not have an emergency department, the time you are unwell, the first person you want to see, if you're having a heart attack, the first person you want to see is not your cardiologist. He will not save you. The first person you want to meet is an emergency specialist. This hospital is going to provide training. It's going to provide training and a focal point for the region. We are going to train healthcare providers, and actually I dare extend the coverage, pre-hospital care, which is non-existent in Nyamira. There's something called pre-hospital care. We want to get to a state where you are sick at home, you call for help, you call our hospital for help. The person who is coming to pick you up to bring you to hospital is trained in basic life support, will keep you alive until you get to the hospital. There's basic life support. When you get to hospital, there's someone who's trained in advanced care life support. There are some foundations right now. There's called the Emergency Medicine Kenya Foundation, which has expanded this space, but they do not have a physical hospital. And this is going to be the first hospital that is going to take care of emergency medicine. Now, okay, thank you. That is your responsibility. It is not a challenge. And I want the citizens here and everybody to know, if your governor is not providing you with healthcare, kick them out. All right? We need people, healthcare. Why are we voting for people and we cannot get healthcare? They get sick, they get flawed. You know what? Even that governor, when he gets sick, he needs emergency medicine. He's not going to get to England surviving. He needs emergency medicine. So, as I said, they need to set up systems that will show our resilience, that will help them also.
Thank you.
Thank you.
Okay.